Hello everyone. Today I want to introduce a drug called Capmatinib, which is a targeted anti-cancer medication specifically designed for metastatic non-small cell lung cancer. Many people may find it difficult to access such specialized medications unless they have family or friends who are suffered from lung cancer. However, I believe that gaining more knowledge about cutting-edge medical advancements can be very beneficial for all of us. Alright, without further ado, let's get to the main topic today. So, what is metastatic non-small cell lung cancer? In fact, metastatic non-small cell lung cancer is a result of further progression from non-small cell lung cancer, where the cancer has spread from its primary site to other parts of the body, such as the brain, the adrenal glands, skeletal system, or liver. Presence of metastasis generally indicates that cancer has reached stage 4, which is commonly referred to as advanced or late-stage cancer. To properly explain today's topic, I first need to introduce what non-small cell lung cancer is. Lung cancer is one of the most prevalent cancers in the world, with various types. It can broadly be divided into small cell lung cancer and non-small cell lung cancer. Non-small cell lung cancer accounts for over 80% of lung cancer cases and is one of the malignancies with the highest incidence and mortality rates. Well, non-small cell lung cancer includes several subtypes, such as squamous cell carcinoma, adenocarcinoma, large cell carcinoma, and adenosquamous carcinoma, among others. The cancer cells in non-small cell lung cancer are characterized by nuclear atypia, abundant cytoplasm, and larger cell size, making it a highly challenging cancer to treat. This provides some background information on non-small cell lung cancer. As we all know, cancer occurs due to gene mutations, and non-small cell lung cancer is no exception. To develop treatments for the disease, we first need to understand its mechanism of occurrence. Therefore, the next point I will introduce is the pathogenesis mechanism of non-small cell lung cancer. Well, the main gene mutations in lung cancer include EGFR, BRAF, ROS1, and METX14. Hearing this list of letters may make you head spin, but it's no need to worry. They are simply the names of the genes. Due to the length of the video and the topic, I will focus on the key points for introduction. The MET gene is a proto-oncogene, which is a cancer-related gene present in the normal genome of cells. Under normal circumstances, it is not expressed, but when abnormally activated, it can transform into an oncogene, inducing cells to become cancerous and eventually develop into tumors. In non-small cell lung cancer, MET is a very important driver gene. Abnormalities in the MET gene in non-small cell lung cancer cells include MET exon 14 skipping mutations, MET gene amplification, MET gene point mutations, MET gene fusions, and MET gene protein overexpression. These abnormalities are not as complex as they might seem. Regardless of the type, they all lead to one outcome: abnormal expression of c-MET, the protein regulated by MET, which results in sustained activation of downstream signals and affects cell proliferation control. As we all know, this causes cells to become immortal and proliferate indefinitely, which is a significant distinction between cancer cells and normal cells. The MET exon 14 skipping mutation is a major cause of MET protein degradation failure. Normally, this gene is responsible for degrading MET proteins that have already served their purpose. However, after the mutation, it can no longer perform its function. As a result, MET proteins are not degraded in the cell and continue to exert their effects. The main function of MET proteins are to promote cell proliferation and migration. Their increased presence directly leads to cellular transformation, fulfilling the two essential conditions for cells to become cancerous: a limited proliferation and metastatic ability. The mechanisms of MET gene locus mutations, gene fusions, and gene amplification directly increase the expression levels of MET protein, c-MET. The result is essentially the same as what was mentioned above. Why am I spending so much time discussing MET? Many of you may have already guessed. That's right. Because Capmatinib is a highly selective MET inhibitor. It specifically targets the unique hinge region of the MET, selectively inhibiting the MET kinase and thereby reducing MET protein levels, which helps in treating non-small cell lung cancer. MET kinase is an enzyme that stimulates MET protein expression and has a binding site for ATP. Capmatinib, on the other hand, is an inhibitor that competes with ATP for its binding site. What is a competitive inhibitor? Let me explain with an analogy. Imagine that woman A is in a relationship with a man. One day, woman B appears and falls in love with the man. Unable to resist the temptation, the man chooses to be with B, breaking up with A. In this analogy, woman A represents ATP, woman B represents Capmatinib, and the man represents the competitive binding site. Since ATP can no longer bind, the protein expression decreases, thereby effectively inhibiting cell proliferation and migration, and inducing apoptosis. This is how Capmatinib works to treat the disease. And how effective is it clinically? From the information, we can conclude that Capmatinib has strong anti-tumor effects for patients with advanced non-small cell lung cancer with MET exon 14 skipping mutations, especially for those who have not previously been treated. Of course, like any medication, Capmatinib has potential side effects. The most common adverse reactions include peripheral edema, nausea, fatigue, vomiting, shortness of breath, and decreasing appetite. Therefore, patients need to have a thorough discussion with their doctor before starting treatment to understand the specifics of the treatment plan and potential risks. Additionally, Capmatinib is also a very convenient medication as it can be taken orally. Well, that concludes all content of this video. Thank you for watching and see you next time. Bye bye.